Can my migraine be caused by my teeth? Hi, I'm Dr. Judith and I'm one of the principal dentists here at Elevate Dental in Melbourne. Yesterday, I was speaking with one of my regular patients and friend, Ben. He'd been having some trouble with severe migraines for a few weeks. He'd been to the GP and the chiropractor, but couldn't find relief or a solution. And that's when his doctor recommended him to see his dentist. What Ben is experiencing is pretty common, so I thought I'd make a video to share with you if migraines can be caused by your teeth. Headaches are so common nowadays, and they can actually be caused by several different things. There are a few different reasons why people may experience migraines. Number one is toothaches. Sometimes a headache can be triggered by an underlying tooth infection, which has a radiating type of pain that can actually move and cause pain throughout the whole side of the face. If you're experiencing unexplainable tooth pain, you should schedule an appointment with a dentist to check for any signs of tooth problems. The second reason why people may sometimes experience migraines from a dental-related problem is grinding. Now, if you grind your teeth and clench your jaws together, it's been suggested that it can act as a trigger for headaches, especially tension-type headaches and even migraines. Most people grind their teeth at night, and most people aren't actually aware that they do it. You can clench your jaw together in times of stress, even during the day or in your sleep. Also, if your jaw is in the wrong position, the muscles in which you use to move your jaw have to work harder, and they can also get tired. And that can lead to a muscle spasm type of headache. There are a few main causes for grinding. Number one is stress. For example, if you've got a stressful period of life, you may experience increased grinding. For example, you might be moving house, changing jobs, things like that. That can usually create a tension type of headache over time. Number two is the lack of oxygen. This is actually called sleep disordered breathing. Now, during sleep disordered breathing, the airflow is interrupted and the amount of oxygen absorbed into your bloodstream and the lungs is reduced. As the oxygen levels drop, it actually triggers the involuntary reflex of teeth grinding and clenching. Now, sleep disordered breathing can range from simple snoring to upper airway resistance syndrome, where you may have enlarged tonsils and adenoid tissue that actually blocks your airway, the more severe form being obstructive sleep apnea. The third main cause of grinding could be muscle tension in the jaws and the neck. For example, if you think about what you might do in your day-to-day life, is there anything that you might be doing that puts more strain on the muscles of your neck and your shoulders than your body is able to tolerate? For example, these days, working from home, if you're on a computer all day, that can make a difference in the way those muscles feel, which in turn can create muscle tension type headaches. Physical therapy is usually quite beneficial in these cases, like ice packs and exercises and routines that can help strengthen those muscles to prevent that. Sometimes, if your head position is altered by the tension in these muscles, it can also alter the way your teeth bite together. And that in turn can trigger grinding and clenching, and you can get headaches towards the end of the day or when you wake up in the morning. So what can you do if you're suffering from migraines? The first thing you can do is to reach out to your doctor and your dentist to find out the main cause of the grinding. We want to find out because whether it's a stress or a muscle related issue, and quite often a common treatment for grinding is wearing a dental night guard or an occlusal splint. And if you're wondering, that's actually what we recommended Ben to have. He had a custom-made night guard and he was so happy because a few days after he had it and was wearing it at night, the migraines just disappeared. He was so grateful. So that's one of the possible treatment options that you've got if you are getting and experiencing migraines and headaches. But at the end of the day, it really comes down to figuring out exactly what's triggering that and what we can do to actually prevent it or to protect the teeth and prevent pain. Here at Elevate Dental, we offer same-day emergency appointments, and we'd be happy to go through your treatment options and give you advice on how to help fix your teeth. We're conveniently located at both Hawthorn and Richmond with free on-site parking. Simply call us on 1300 to SMILE, complete the form on our website or direct message us on social media, and we'll be in touch to help you organise your consultation. See you in the next video.